Hey everyone, this is Sally Hayes, founder of Matrikas. We're a directory of fertility, pregnancy, and postpartum providers and brands. And today we are talking with Dr. Denise Wiesner, doctor of acupuncture and doctor of Chinese medicine. Did I get that correct?
Yeah, that's good.
Yeah.
Good enough.
Can you introduce yourself a little bit? I know that you've been practicing for 31 years here in Los Angeles. Can you give us a little bit of your background, how you got into acupuncture, and what you specialize in?
Uh, Thank you. Uh, I've been practicing, yes, like for 31 years. I can't believe it. And I got into acupuncture and Chinese medicine because I was having my own kind of digestive issues actually at the time. And a boyfriend of mine was renting space from two acupuncturists, and I started getting treatment, and it kind of changed my road. And then everyone I met did Chinese medicine and said, "You'd be a great acupuncturist." So there I was in studying acupuncture.
That's so fun. I love that story. I love how everyone comes to their specific work because it's always like such a weird weaving road.
Yeah.
And I know you are one of the few people in Los Angeles that specialize in fertility, but really you specialize in reproductive health. So could you give us a little bit about like who your patients would be and who the ideal patient for you is?
I mean, I treat anyone, any woman, and I also treat men, but I treat women going through all the stages of reproduction from adolescence. So I'm seeing adolescents with very bad PMS these days. I have women with PCOS, endometriosis is one of my specialties. Infertility for sure. People that are going through IVF, IUI, or even trying on their own. And I also treat menopause and perimenopause. Well, I should say perimenopause first. Perimenopause, then menopause. And I'm also a certified sex coach. So I feel very comfortable talking about sexuality and how that pertains to all the things that mentioned that I treat, because it
That's
does.
so interesting. So, as a certified sex coach, do you talk with individuals one-on-one or do you do work with couples or both?
But both. I'll talk to individuals one on one, and I also have couples that I try to get together. My book Conceiving with Love is about sexuality and fertility and Eastern medicine. So it's really trying to get couples back into intimacy, because sometimes making a baby takes you out of that. You get exhausted and you just don't feel like it. And I have all sorts of problems that happen during that baby making time. Yeah.
That's so cool. So, there's so much to dive in here. So first, let's kind of talk fertility at the beginning of it. So you treat people with with infertility that are trying to achieve pregnancy. How do people come to you? Are they already actively trying to conceive, or do you see people before who maybe are exhibiting symptoms of PCOS or something like that, and you start and then they start trying to conceive, or is it a mixed bag?
It's kind of everything, right? I mean, I have girls that are trying to freeze their eggs, right? That I'm seeing also right now. Some with PCOS, some with endo, some with, if they're fertility, I get them, they're doing an IVF transfer tomorrow and they want to see if they can do a pre-transfer at my office, or I'll come to their transfer. So I treat everything at all different stages. Ideally, it's great if I get them before, but everybody comes to me at the perfect time, I think. So yeah.
Oh, I love that. I hear a
Yeah.
lot of people say, I wish I saw somebody earlier. I wish I got to people earlier, but I like that you're saying you see them at the perfect time.
I mean, I think it's a journey, right? I mean, this whole life is a journey, and that we know that what the perfect time is. I used to think that, but I don't anymore. I just sort of trust in the journey that people need to go on, that I need to go on, and how it unfolds. Yeah.
That really resonates because it is more of cycles, like a series of cycles in your life rather than a linear line of, this is the time that should happen, this is the time that this should happen.
Yes.
So, yeah. So, do you also, I know some acupuncturists do herbs, some do not. Do you also
I
prescribe?
definitely am. Yeah, I'm definitely an herbologist. I usually make custom formulas for my patients if possible. Sometimes I won't. I'll have things off my shelf. I also use nutritional supplements, and all the things that have to do with women's health. I pick and choose and give
Full
them
spectrum?
recommendations. Full spectrum.
And you treat people here in Los Angeles, but what if you're outside Los Angeles or in another state like Kansas or something? Can people have access to you too?
Yes, I mean, I do a lot of fertility coaching and intimacy coaching, and And yes, absolutely. Yeah.
I love that. I'd love to hear a little bit about your book.
Yeah, I wrote a book, got published by Shambhala in 2019 called Conceiving with Love, and it's on Amazon. And it's really a deep dive into all the things fertility and also intimacy. So there's chapters on stress, on foreplay, on anatomy, and also things to do when trying to make a baby becomes difficult for partner exercises. And there's also, through the lens of Chinese medicine, we talk about all the things Chinese medicine that have to do with fertility. So it's just sort of a East Asian look into intimacy and fertility and sexuality.
Yeah. Do you feel that people are really open to Chinese medicine, or when they come to you, do they feel like it's like a whole new world that they've never heard about? Do you feel like, I think in LA, we have people that are a little bit more open to Chinese medicine maybe than other locations?
Yeah, I mean, I think Los Angeles people are pretty open, and people, friends will say, go see Denise, or you need acupuncture. I hear it all the time. Although I have someone flying in to see me, I think tomorrow, who's getting a transfer, and she's come to see me in my office. So everywhere, I think it's becoming more standard for people to use Eastern medicine and acupuncture along with fertility. Yeah.
And are you seeing any trends that are changing in fertility, like now versus 10 years ago? Are you seeing different clientele?
Actually, yes. What I'm seeing now is a lot of younger girls. Like, I don't remember seeing girls in the 20s and 30s with PCOS. I don't remember seeing that, or endometriosis. And I can't tell if it just people are more wise and they're not just being slapped on the birth control pill, or maybe women want to take charge of their health a little bit more. But a lot of younger women who are, contemplating egg freezing, if you will, like in their 20s. And early 30s. And that's really different than I've seen before. I used to just see more, older women, but now it's younger women having fertility issues or having their AMH, which is the ovarian reserve test, anti-Müllerian hormone, be very, very low. It shouldn't be that low when you're young. And I'm seeing women that are panicky about that change. Yeah. Yeah.
That's interesting. I guess it's really cool that people are getting more informed earlier on and able to take control of their health before they get too far down. But also, I have heard that infertility is rising about 1% per year. Do you have any thoughts on why or what you can do to, I guess, maintain your health?
Yeah, I think I'm seeing that a lot more infertility and issues. And I want to bring it back that it's really generational, right? It's really like if I had girls, I have boys, but if I had girls, they when I'm pregnant with them, are making all the eggs that they are going to use, right, to make their kid. So my health is going to affect two generations. And I think that's so important. And that's like my use of plastic drinks and how the environmental impact, right? So it's kind of like my generation is going to be doing my kids having kids generation. And gosh, how many plastic water bottles did I drink out of when I was, when it was like, oh, plastic water bottles is the best way to get water, right? We all could have drank that Kool-Aid,
Right.
or water, if you will. But so, I mean, I think the environment we didn't have that knowledge of really how bad it is. And so I think the generations are paying for it, if you will. Yeah.
Yeah, that does make sense. And then going through fertility, you also see people, obviously, if you're going to work with people through fertility, they're probably still going to be your patients through their pregnancy and beyond as well.
Yes. Yes. I do pregnancy. People come to me for doing their whole pregnancy. Yeah.
That's so cool. And and then post-pregnancy, let's say they have a few pregnancies and then they're going to hit that point of perimenopause. So are you seeing patients in perimenopause?
I definitely am. In fact, it's really cool because I see their kids, they're grown up. I mean, this is the wonderful thing about practicing for so long, right? Their kids are grown and now they're going through perimenopause. I have quite a few patients where, this is happening and a lot of them feel like they did so many hormones. They don't want to be on more hormones. They don't want to do hormone replacement because they feel like they inundated their if they did IVF with hormones, which is quite fascinating. So I'm doing a lot of perimenopause, menopause these days.
That's cool. So I know, I personally have a lot of friends in that perimenopause area, and the number one kind of little conversation is people don't know who to turn to. A lot of people want to go to their OB and ask about that, and maybe they're getting hormone therapy. What are your opinions about perimenopause? And if you think you're entering that phase, who's the first person you should talk to?
I mean, I think if you're in perimenopause, it can be like it's different for everyone. It's really an individualized medicine. I am not against hormone replacement, excuse me, hormone therapy, it's called now. It's like the right fit for the right person, but I don't know that it's a one size fits all approach. Yeah. And so I think we have to really do individual medicine. And I've actually spoken to quite a number of OBGYNs, and there's some that do hormone replacement, hormone therapy very well, but that's the only tool in their toolbox. Meaning, if you go to them and you're in perimenopause, they want to get you on hormones because that's their tool. Yes. So I think what we do our whole life is going to affect our perimenopause. And I think for me, I love when I see women in perimenopause because I can help modulate their symptoms, right? Maybe they don't want to go on hormones right away and they just want to deal with things, but life has become very stressful for many, yeah. I know Los Angeles, we were talking about earlier, the fires, and it's really affected people. And then they have more symptoms, right? Because adrenal glands and hormones, your whole endocrine system gets kind of out of whack. So preparing for perimenopause is really taking care of yourself for fertility. It's all the same, being healthy, yeah? Trying to get your working with the seasons, working with your emotions, your body, really the spirit, everything. And that's high fertility. It also helps you with perimenopause. Yeah.
I love that. Yeah. So you don't have to do hormone therapy
Yeah,
in
I mean,
menopause.
it's not for everyone. In fact, I see patients sometimes when they're on hormone therapy, they have so many problems. That I have patients that, I have a patient that was taking progesterone and she would just be in bed. She couldn't even get out of bed. She was weeping and weeping and weeping, felt horrible, even on the slightest amount. And you have to do, if you have a uterus, you have to take progesterone with estrogen therapy. You can't just take estrogen alone because it protects you from endometrial cancer. So in those cases, hormones are not the right thing for this particular woman. And I see those kind of patients where they need alternative medicine, they need complementary, they need herbal medicine, nutritional stuff, and acupuncture to help with the side effects of perimenopause.
So in addition to needles and herbs, you also talk to people about their nutrition and do more coaching with them and talk about lifestyle things as well.
Yeah, yeah, you have to, right? I mean, we're affected by our environment, we're affected by our relationships, we're affected by our friendships, by how our work situation. I feel like that's the beauty of Chinese medicine is it looks at the whole person and not just like your ovaries and uterus, right? What's going on? And I think it's an incredible individualized medicine, as medicine should be. Like, what's this particular person and what do they need? And it's different for everyone.
I love that. I think that's the basis of everything, right? Like
Yes.
individualized, like, I was just speaking to someone about like trends and food trends, and sometimes people get really caught up in these like nutritional trends that may not be right for you, though. Like that's great that it works for the majority of people, but you're an individual that may not necessarily, that may not be what you need for that.
So I totally agree. And there's so many, right? I've witnessed so many food trends and so many like everybody's intermittent fasting now and everybody's doing this and it's not right for everyone. Yeah.
Absolutely. Yeah, I fully agree. I'm a little wary of trends just in general, just because I want to know where it came from and what's happening. I personally love acupuncture. I think I I don't know how to describe it other than it's magic. You can feel it. Like you can feel the magic energy moving around your body. It sounds crazy, but it like absolutely works. I love herbs. I think that seeing someone who's looking at your constitution and figuring out what you particularly need is really great. So how young is your youngest patient?
I think I have a right now a 14-year-old. Uh,
Wow. Okay.
no, it's interesting. She wants to be a dancer and she's lovely, but she's in a lot of pain and sort of like how's that going to be when you're I think she's 14. Yeah, I've seen pretty young right now. That's my youngest at this moment, but I've seen 8-year-olds. I mean, I see people going through, their moms are like helping them with want to help them with hormones or PMDD or, they're just a mess and trying to balance things out a little bit in the most natural way I can.
Yeah, I love that. I think it's so important. I grew up in a really small town and we didn't have acupuncture. I had to move to, well, that's not true. I did, before I moved to LA, I did hear about it, but it was definitely not commonplace,
Yeah.
especially as it is out here. We're very fortunate. So how can people get in touch with you and find out more about your services? So if somebody's interested in anything from fertility through menopause, how can people find you?
I mean, I think the best is, I mean, they can also DM me on Instagram, that's, Denise Wiesner, LAC, or they can go to my website for my clinic, which is naturalhealingacupuncture.com. And that also will take you. You can send me a personal message and I'll get back to whomever wants to get in touch with me.
Great. So head to the website, check out the book. Remind me that the book is called Conceiving with
Conceiving
Love.
with Love, yeah. It's on
I
Amazon.
love that. You don't have to be in LA to receive treatment. You can be outside LA. There's lots of coaching. Yeah, I love this. I love what you're doing. I love that you've been doing this so long and you're still so passionate about it.
I know, I love it. But just like you, right? I mean, I look at you and I think, oh, yes, this is a kindred spirit.
Yeah, yep. I've been practicing massage for 26 years now, which is insane to say.
Exactly what I was saying, kindred spirit.
It doesn't even seem real. Yeah, but I'm about to get good at it.
I no doubt you are fabulous.
I love it. Well, thank you for talking with me today. And I'm always so happy to talk to you about everything that you do and how rich your work is. And yeah, it's just always a fun conversation. So I really appreciate your time and everybody go
Lovely.
check out the website and figure out what you need and what you can use. Yeah.
Well, thank you so much. I'm honored actually.
Yeah. Yeah. Thanks for talking with me. I'll talk to you
So
soon.
much. Bye.